I'm Dr. Gayatri, a neurointensivist at Sagar Hospitals, Bangalore. Now I will be telling you in brief about the admission to the intensive care for patients with stroke and why is it required. We all know that stroke is one of the leading causes of death worldwide. Stroke can either be an ischemic stroke or a hemorrhagic stroke. What is ischemic stroke? Ischemic stroke is that when blood supply to a particular part of the brain is cut off and that particular area of the brain dies. That is called as ischemic stroke. And in hemorrhagic stroke, blood comes out of the blood vessels into the brain parenchyma, leading to death of brain tissue in that area. That stroke can vary in severity from mild to severe, or in some cases it can even be a malignant stroke. Now, why do we admit such patients to the ICU? Patients need admission because for the following reasons. First and foremost is that we need to monitor the brain function. By looking at the brain function very closely in ICU, we will be able to understand whether the patient is having a progression of stroke. That is, what is mild can become severe in no time. So to understand that, we closely monitor the patients for their brain function. For this, we do two things. One is called as a Glasgow Coma Score. This is done at the bedside by the nursing staff every now and then, very frequently, and we have a scoring system based on their patient's response to stimulus. It is divided into three parts: the response to the patient, movement, as well as verbal response and eye response. So this will tell us when the score comes down, we know that the patient's stroke is progressing. We also look at the eyes. We call it as pupillary sign. That indirectly also tells us whether the patient's stroke is progressing. So this is one thing. And number two, why do we put them in ICU is because we want to avoid certain factors which will result in secondary brain injury. So what is primary injury? The primary brain injury is that part of the brain which is injured due to stroke. And what is secondary brain injury? There are certain factors such as oxygenation or lack of oxygen, as well as decrease in blood supply due to fall in blood pressure for whatever reason. They can lead to brain cell death, which is called as a secondary brain injury. So therefore, our aim is to prevent secondary brain injury in those patients who had already suffered stroke. So we monitor oxygenation as well as blood pressure continuously in the ICU to prevent these two factors from affecting the brain secondarily. And third thing, why do we put them in ICU is because the treatment that is given for stroke, that is thrombolytic therapy we call, that can cause sometimes complications. And to understand whether these patients are developing their complications and treating them, we need to monitor them in the ICU. And again, the parameters that we monitor are very vital to the patient's well-being. Now, not only monitoring of the patients, but also treatment is important. So, in the ICU, the treatment and monitoring proceed simultaneously, hand in hand, without wasting any time, and hence we improve the outcome of the patients in the long run. So that is why intensive care management and admission is very important to patients with stroke.